Welcome, everybody. Looks like folks are joining right now. We'll give it just a few minutes and we can start the program. See the numbers are ticking up here. Welcome, everybody. This is the CalCare City Council Resolutions Training. If that's what you're here for, you're in the right place. We'll be starting in just a few minutes. And this is a joint training with the California Nurses Association and Public Citizen on how to pass a city council resolution in support of CalCare and Medicare for all. So if you're just joining us, please go ahead and introduce yourself in the chat with your name and city and let us know how you're feeling right now. We have a really special lineup of speakers and organizers for this call. And tonight we'll be hearing from Long Beach Mayor Robert Garcia, Los Angeles Councilmember Mike Bonin, Oakland Councilmember Sheng Thao, Melinda St. Louis and Brittany Shannahan from Public Citizen. And we have some special activists on the ground in Los Angeles, San Luis Obispo, and San Diego. So let me check the numbers here. Yep, looks like folks are joining. So welcome again. And on behalf of the more than 100,000 registered nurses of the mighty California Nurses Association, I want to thank you all for being here. The nurses of CNA have been fighting for decades for single-payer guaranteed health care here in California and for Medicare for all nationally. Every day, the nurses see firsthand the harm and devastation that our profit-driven healthcare system causes to their patients. And especially during the past year of the COVID-19 pandemic, they have seen how the profit motive in our broken system puts all of us at risk by neglecting the equipment, safe staffing, and safety protocols that nurses need to safely take care of their patients. So we're really excited that AB 1400, the California Guaranteed Healthcare for All Act, was introduced a few weeks ago by Assembly members Ash Kalra, Alex Lee, and Miguel Santiago, along with 16 of their colleagues in the legislature. This bill, AB 1400, would create a Medicare for all type system in the state of California, guaranteeing high quality healthcare to all residents of California. As Melinda will talk about here in a second, passing city council resolutions will be an integral part of our plan to organize in every district throughout the state. And we are committed to building a campaign based on the nurses' values of love, compassion, and community organizing. It's going to take a mass movement to win guaranteed healthcare, and we're so grateful to be working alongside all of you on this call. So without any further ado, let me pass it over to Melinda St. Louis from Public Citizen.
Hi, welcome everyone. Again, on behalf of Public Citizen and the National Medicare for All Resolutions Coalition, I also want to welcome all of you to today's exciting training. For the past couple of years, a broad coalition of organizations has come together to support grassroots leaders around the country to pass municipal resolutions in support of Medicare for all, as well as state-based single-payer health legislation where that's been appropriate. Our campaign has produced a really winning formula that we've been able to use by activists of all experience levels to pass resolutions in their communities. Already, more than 330 local efforts are underway in cities and towns in blue, red, and purple states. We've won 55 such resolutions so far in support of Medicare for all, including many cities in California, including San Francisco, Oakland, Los Angeles, San Luis Obispo, Chico, Santa Barbara, and a number of smaller towns as well. And in doing so, we've recruited powerful champions for Medicare for all among these local elected officials, and we've built enduring local coalitions and used the process to get local media attention and educate members of the community. So now that the California Guaranteed Healthcare for All Act has been introduced in the State Assembly, we're excited to help the CalCare campaign include this municipal resolutions tactic in your full toolbox that we will be using to build the power from the ground up across the state to show our state legislators that it's not just activists who demand that they act now, but also cities and county governments in their districts as well. So in tonight's training, we'll discuss and share the infrastructure and grassroots toolkit we have built to support activists in cities and towns, large and small, to win local resolutions in the city and county councils in support of CalCare and Medicare for all. So we're excited to work with all of you who have joined this meeting. Before we get into the nuts and bolts of how, we are thrilled to be joined by three powerful California local elected officials: Long Beach Mayor Robert Garcia, Los Angeles City Council Member Mike Bonin, and Oakland City Council Member Sheng Thao, who have become powerful champions of guaranteed healthcare for all. And they will explain why municipal governments have an important role to play in building support for CalCare and Medicare for all. So first, we'll hear from Mayor Robert Garcia, who has served as the mayor of Long Beach, California since 2014. Last year, Mayor Garcia co-founded the Mayors for Medicare effort, the goal to build a network of mayors across the country taking a stand for Medicare for all. So we're really thrilled that you've been able to join us, Mayor Garcia.
Thank you very much, and I'm just happy to spend some time with everyone today. I see a lot of friends, especially Councilmember Bonin there from LA, my buddy. I want to just share a few things. And I think first, everything you said is absolutely correct. Want to start by saying, back in 2016, when, if we all remember, the SB 562, which of course was that bill that was bringing the single payer conversation really to the forefront. Long Beach took a stand at that point, and a good friend of mine at the time, State Senator Ricardo Lara, had introduced the bill. And that really, for us in Long Beach, started our interest in just kind of backing up our local nurses and the community around the Medicare for All movement. Over the last couple of years, there's been a group of mayors that are part of the U.S. Conference of Mayors. And that is the coalition that every mayor in the country is essentially a part of. It's our network group. And there's been a group of us, especially me and the mayor of Oakland, had been talking often about forming a caucus at first of mayors that support Medicare for All and that have for years, and that want to build a nationwide network. And so her and I co-chair the National Mayors for Medicare for All group. It's actually about 20 mayors currently that from all across the country that have officially endorsed Medicare for All, and that work with our cities to pass resolutions, of which we all have. Our goal, we just started this group last year. Our goal actually is to get to eventually 100 mayors, and then to submit a resolution to the U.S. Conference of Mayors for the National Mayors Organization to take a public position and to support Medicare for All. So that is our ultimate group as mayors. And of course, the efforts that are happening now in the legislature and others, we also support. But we're a national organization that's really focused on getting the U.S. conference on record, because we know that when there's a lot of debate around Medicare for All, as a mayor, I don't think people really oftentimes talk about how common sense and practical getting Medicare for All is for cities and for the country. As a mayor, healthcare drives everything around us, and the health of the community, especially in this last year during COVID, is really, really critical for us and our work. And so mayors oftentimes aren't as involved in some of the big congressional debates or legislative debates. So we thought it was really important for there to be a voice, and mayors especially, mayors are oftentimes running in nonpartisan races, for us to come out and be able to say, look, Medicare for All is good for cities. It's good for local governments, for us to be able to take something that already works. And that's what always, I think, when I have talked to friends about Medicare for All, the thing that drives me crazy is that we already know what Medicare for All looks like, because it already exists for a certain part of the population, and it works amazing. And it already is structured in a way to support people within our community and our older adults. And so to expand that system for everyone is not rocket science. It's not radical. It's not something that we should have this huge debate about. It's about wanting that level of care and access to healthcare for everyone. And I think that's something that more and more people understand. I think the public over the last few years really has understood that healthcare access, everyone should have the same level of care and access, and getting us out of the business of someone's healthcare dependent on where they work, I think is something that's really, really important. We, as the nature of work changes in the future in cities and in our country, as the insurance industry continues to balloon around healthcare, and we know what's going on with costs, we have to de-link that connection between an individual and their ability to get a job that provides healthcare for them. We need to get to a position where the government can serve as the vehicle to ensuring that everyone has access to healthcare. So I'm really proud of the work that our coalition is doing. We're active right now on social media. We're constantly reaching out to mayors. We're a small but mighty coalition, and we're talking to legislators as well, and our partners in both the Senate and on the House side about our position as mayors and why we support the work that so many of you and CNA and so many others have been so involved with. So we plan on being an active voice in the healthcare conversations and debates in the future. And a lot of us, what's also I think interesting about our group is, a lot of us come from all sides of the kind of Democratic, all of us in our group currently right now are Democrats. We'd love to get some Republicans, obviously, but we all come from like various parts of the party and various parts of the spectrum. And so, yes, there were folks that supported Bernie, but there's a lot of Biden folks and Kamala folks and other folks. And so we come to it from a position of, we think we can speak from a mayor's perspective that this makes sense for everybody. So we're happy to be here, and want to add one more thing. We are gonna, if anyone, we're gonna start a very public campaign over the course of the next couple months to get a lot more mayors across the country signed up, including encouraging people, a campaign to encourage folks to get their mayor to sign up. We do have some California mayors on board. A lot more are signing on in the weeks ahead. And any way that we can help in our group here for the California efforts, I did talk to Assemblymember Carla just a few weeks ago, right before he introduced his bill, and I shared with him that same day that he obviously has our full support, my full support, just like when we supported the 2016 effort. And so we're excited to do what we can and to help all of you as well. So mayors are on board, cities are on board, and we're happy to help in any way we can.
That is so great to hear. Thank you so much, Mayor Garcia. Thanks for your leadership down in Long Beach and nationally with Mayors for Medicare for All. So everybody reach out to your mayor and have them join Mayor Garcia. Appreciate it. Okay, so now it is my honor to introduce Los Angeles City Council Member Mike Bonin.
Thank you, Phil. Thanks for the intro. Thank you to the nurses for putting this together. And while thanks are always in order, a special, deep, heartfelt appreciation for the past year and the amazing work that our nurses have been doing. Shout out to Mayor Garcia, who really has been doing a remarkable job leading Long Beach and providing healthcare. There is probably no more powerful spokesperson at the local level on healthcare than Mayor Garcia, who has done just an amazing, heroic job. And thank you to everybody in the chat for all the love people have known for 15 years, current constituents, colleagues on previous campaigns. I love the energy here because this is the energy that we need. Back in, right before the pandemic, it was November or December of 2019, our city council passed a resolution in favor of Medicare for all. And it was the right thing to do then. It continues to be the right thing to do now, and it's even more urgent that other cities get on board and do this, and that we build the groundswell from the bottom up for Medicare for all, because we are taking on some very powerful, some very entrenched special interests. And the only thing that is going to beat that back and is going to win is going to be the activism and the grassroots energy that is reflected on this call today. When we did it, back in 2019, I did get a little pushback from a couple colleagues and from some constituents who said, why are you doing this, Bonin? This is not a local issue. Like hell it isn't. There is no more local and no more personal issue than healthcare. From just a pure fiduciary standpoint, running a city, It is a hell of a lot better for us to be able to have Medicare for all. It will impact healthcare costs everywhere. It will improve our budgets, and it will take a lot of the burden off cities that don't generally provide healthcare, but wind up dealing with the consequences of a broken healthcare system, whether it's homelessness or lack of economic productivity. Cities don't cause a lot of the things that they wind up dealing with, and then they're stuck dealing with them. And a broken healthcare system is one of the things that cities deal with. But it's also just on a moral level. These are our people. These are our neighbors. These are our residents who are going without healthcare. These are our moms who are deciding whether or not to fill a prescription or whether or not they can afford to send their kid to soccer camp, right? These are the people that we represent, that we talk to every day. And we are in many ways in government, their first line of defense and first line of advocacy. And right now, one of the biggest issues that we face in the city of Los Angeles and across the country is equity. It is finally a word that is on the lips of more and more Americans than ever has been. And we are never going to get healthcare equity until we have Medicare for all. And in Los Angeles, it is particularly important because while there are some estimates that 13% of the country may be uninsured, in Los Angeles County, it's nearing 20%. And now with all the unemployment that has happened over the past year, I'm sure it is even over 20% now. We need to get this done. We need to get people on board for this. And if you're worried that you might not be able to get this done, you might not be able to get your city on board, you can do it. You absolutely can do it. You can organize, get out there, tell your truth, use personal narrative, use personal stories, talk about how a lack of healthcare has impacted you or your family or your neighbors. Bring that to your elected officials and demand that they act. And eventually, with enough pressure, elected officials will and do act. We are blessed in Los Angeles to have some of the most passionate, brilliant, amazing activists around. And you have that in you as well. Or our activists here will help you. They will share what they have learned and they will spread that energy. We're taking on the pharmaceutical industry. We're taking on the insurance industry. We're taking on special interests. This is a battle that in one form or another has been waged for generations. And we are now, as we are seeing the Biden administration and a new Congress do things that seemed unimaginable just a few weeks ago, we have a potential to really shift things. We can take this moment and this energy and finally get Medicare for all across the finish line. And we have the power on this call, in your neighborhoods, across California, across the country, to make Medicare for all happen. And that begins today. Thank you.
All right. Thank you so much, Councilmember Bonin, leading the effort down in the City of Angels there. And later, we're going to hear directly from some of those activists that Councilmember Bonin was talking about in Los Angeles. We have Sheng and Sheng. They're going to talk about that a little later. So next, it is my pleasure to introduce from the City of Oakland, Councilmember Sheng Thao. Welcome, Councilmember.
Thank you so much. Like Phil said, I'm Councilmember Sheng Thao. I am Council President Pro Tem on the Oakland City Council, where I represent beautiful District 4. I am introducing a resolution in support of AB 1400, which will be voted on this upcoming Tuesday, March 16th at 1 p.m. So if you would like to call in support of this, this is listed as item number 2.6 on the agenda. It is incredibly important to pass these resolutions in support of Medicare for all within the cities. You would assume that it's a state issue and that let the legislature figure it out, but absolutely not. We need to actually show our legislature, our representative, that each city, we have a voice, and that our voices are that we feel like people deserve the access to have great health care. And I wanted to take a moment to also appreciate CNA. Thank you so much for hosting, and Public Citizen as well. And also Assembly members Ash Kara, Alex Lee, and Miguel Santiago for introducing this incredibly important bill. This bill, Medicare for All, is very personal for me. I grew up as a daughter of refugees. My mom is illiterate and she can't speak or write. She doesn't know how to drive. You know, they're refugees, so their diet, it's a lot different than what it is here in the US than what it was like in their home country, which is the mountains of Laos where they farmed every day. And because of that, they are experiencing diabetes, high blood pressure, all of these things, which is causing, you know, liver damage, kidney damage, or what have you, because of the medication they take. And the medication they take isn't actually the best. I grew up living, you know, I grew up with food stamps and on Medi-Cal. And I can tell you that there is a difference in how people who have Medi-Cal get treated versus people who actually have private insurance. I know that because it is my lived experience. I can tell you that my mom is back in the emergency room yesterday. She's back in the emergency room, and it is very difficult when you're not staffed appropriately and you don't have interpreters. And I have to call my mom on FaceTime in order to, you know, and she's scared. She doesn't want to go in, you know, but they can't offer her certain drugs, or they can't offer certain services because she doesn't have insurance to cover. I mean, what are we talking about here? We're talking about people's lives, and we're talking about, you know, whether or not someone's life, whether what is the worth of someone's life. I mean, that's pretty ridiculous to me. For me, I'm incredibly passionate about this because I feel like everyone deserves great healthcare, no matter which zip code you live in, no matter, you know, which area you live in, or how you you know, which household you were born to. Right? It's just a human right. It's common sense. When my dad had his stroke and he was bleeding in the brain, they told me that because he didn't have insurance, that we would need to take him, and he was paralyzed, in our own private vehicle to transport him from Stockton to Sacramento, because that's the nearest neurology surgeon. And so I don't know how I was going to pick up my dad and put him in the car. And so it just didn't make any sense to me. I mean, there is a mistreatment in regards to people who don't have resources or are under-resourced versus people who do have the resources and who have the privilege. I, as a council member, I can't even, you know, how I feel some kind of way because I feel like I cannot even provide for my parents who took care of me and raised me. I have insurance, my parents don't, because they don't live with me. And this whole treatment of treating certain people differently because of their socioeconomic status is out of line and inhumane. It is extremely inhumane. The only way forward, the only path forward is Medicare for all. It is a human right. It is the humane thing to do. And your life and my life are all equal. No one is better than the other. And so I stand here strongly, shoulder by shoulder with CNA and with you all, my brothers and sisters, to move forward and get California on the right track. And eventually, as California goes, the rest of the nation will. Thank you. I'm Councilmember Sheng Thao.
Thank you so much, Councilmember Thao. Those were extremely powerful words, and we are so grateful for your leadership, and thank you for leading the way this coming Tuesday, and for Oakland for being out front, and just how important it is for us to have people like you who run for office and take these issues forward. So thank you so much. As we've heard from these powerful municipal government champions that we already have, local governments really can play an important role in highlighting the desperate need for a single payer guaranteed healthcare for all system. Local government officials understand all too well the consequences of our unaffordable and inequitable health insurance system that has become tragically even more the case in the context of the COVID-19 pandemic and the economic downturn. Municipal budgets are increasingly strapped as health insurance premiums increase. Local businesses are struggling to make ends meet due to rising health insurance premiums, or they've been forced to lay off workers who've then lost their insurance right in the middle of a pandemic. And local governments often provide the frontline response when community members face medical debt-related bankruptcies or become gravely ill or die needlessly because they lacked adequate health insurance. So by passing resolutions like these, local governments can help shape the statewide and national public narrative and build the political will that's needed to ultimately win CalCare and then Medicare for all. The great news is that there are already strong networks of activists across the state who have been successful at organizing for municipal resolutions. This pandemic has really put the tragedy of our for-profit healthcare system in stark relief for municipal governments, and many city councils have been more receptive to the idea of passing a resolution in recent months than they were previously. We've seen this over and over again. And so now with the excitement around the possibility of actually winning AB 1400 in the California Assembly, we have the opportunity to really jumpstart these efforts across the state. And that's where each of you come in. So whether you're a seasoned health justice organizer or you're just getting started in your activism, we have the tools and guidance to help you feel supported and dig in now. City council members are more accessible to constituents than federal or even state representatives. So this process can be really empowering, base building, organizing opportunity in your community as well. We were thrilled that our most recent resolution that passed in the city of Santa Barbara just a couple of weeks ago included support for AB 1400. So we're already getting started, and we're ready to multiply that success, obviously in Oakland and then beyond. So this is a really great pressure tactic. Because if your state assembly member or federal representative is already a supporter of the bill, that's great, but resolutions passed in their district will provide them with more cover to stand strong against the extreme pressure that they're going to face by the for-profit insurance and pharmaceutical industry when the rubber hits the road. It's also a relevant tactic if your representative is on the fence and hasn't decided yet, because if many municipalities in their district demand that they take action, that will carry much more weight than just activists urging them to support the legislation. So it's another pressure tactic. And it's even relevant if your state or federal rep is hostile. You'll know they'll never support this policy, because this is the way you can educate and build the base you're going to need for our longer term strategy to elect officials who are supportive. So please join us. So this is the first pitch. With sign up to join an existing effort or put your town on our map of efforts. So we are going to paste in the link to sign up in the chat. You can sign up your community and connect. So now I'm going to pass it over to my colleague Brittany, who's going to share more about the resources to help you get started. So this is our nuts and bolts section. So go ahead, Brittany.
Hi, everyone. My name is Brittany Shannahan, and I am the Medicare for All organizer with Public Citizen. Most of my work revolves around providing resources, connections, and direct support to grassroots activists around the country like yourselves who have organized to pass municipal resolutions in support of Medicare for All. I want to take a brief moment of your time to go over some resources that we've pulled together that you'll find useful in your campaign, whether you're just getting started, you're already working with a group, or even if you've already passed a resolution. So let me share my screen. There we go. So here is our California Toolkit page. Melinda will share the link with you in the chat, and we will also be including these links in a follow-up email after this training. So the first thing I want to draw your attention to is this link towards the top here, which directs you to our map of current and past resolution efforts. I'm going to zoom in on California just a little bit. You can click any of the blue dots and you'll be directed to a page where you can register to sign up for a new or existing resolution effort. Let me go back. If you scroll below the map, you can also see a list of all the municipalities that have passed resolutions, and you can also see the text as well. So if we had, I think here's one for West Hollywood. It may take, oh, here it is. So you can also see what people have put in locally. But in addition to that, so there's nearly 70 cities, towns, and counties where we have already have folks who are interested in working on resolutions in the state of California. So you can find a place close to you, or you can add your town to the map and we can connect you with other like-minded people. Now, let me go back here. The next thing I want to show you is this resolution template that we've come up with together with our partners at CNA and other California organizations. Let me see, sample language. This is meant as a template. So many activists have added text towards the beginning of a resolution that cites local statistics about issues like uninsurance rates and other health inequities in the municipality, because every municipality has its own unique story, and that could be really powerful when you add it in there. Other cities have just taken a resolution like this and passed it without adding that information. We will update this text with the HR bill number after the House bill is introduced next week. So moving back, I'd like to bring you to our step-to-step guide, which is at the top of this toolkit page. If somebody could share, I hope somebody shared that again, because I imagine it's run out of the chat, but we will be sharing this link with you in an email. So if you lose it, it's okay. This is the step-by-step guide we've put together to help you work on your resolution. We've broken this down into pieces to help you know how what to expect and to decide where to focus your energy. We have some tips for approaching council members here, as well as a sample outreach email that you can use to set up to request a meeting. So here's that sample outreach email, just in a nice little Google Doc that you can copy and paste. We also have a lot of tips about how to keep that pressure going, because sometimes it's not always the first email that you send that gets a reply. So in addition to this, we also would encourage you to, when you have a chance, to look back at this toolkit and look at some of these quick resources that have, as well as that have other resources such as sample California focused press releases and fact sheets about CalCare and Medicare for All. We will also add a link to the recording of this webinar to the toolkit. And next week, our team will be reaching out individually to everyone who's attended tonight so that we can link you to local activists working on a resolution in progress, or so that we can set up organizing calls for various cities that haven't had something going yet. So please do stay tuned to your inbox to learn about calls that we're going to put together in your area. As well as if Melinda could share the link to sign up on the map, please do sign up on the map as well if you haven't done so before. But now I would like to pass the mic over to Cheng Sim Lim and to Sean Broadbent, who can talk about what they learned from their successful campaign that won a resolution in the city of Los Angeles. Hi there.
Hi, Brittany. Sheng Sim, did you want to go first? No? Okay. Well, thank you, everyone. It's an honor to get to speak with everybody tonight. I hope everybody's fired up to pass some resolutions where you are. When I felt compelled to get involved, I had only ever been a voter in primaries and general elections, but this was really important to me and something that I just knew I had to take action on. And I was lucky enough to make contact with one of the nurses with California Nurses. And they told me about this push they were going to be doing for HR 1384. And they wanted people to host barnstorms. So having never done such a thing before, I looked at their map and, didn't see an event in my area necessarily. So did agree to host, but immediately reached out to the other people who were in my area hosting. So this is before I necessarily knew about Public Citizen and their campaign for Medicare for All resolutions and the connecting work they do. But that was the first really important thing I learned, was that you have to reach out to the other people in your area so that you're never doing this work alone. So right from the get-go, I was like, how can we promote together? Can we get on each other's posters? You're going to do your event on a Saturday. Mine's going to be on a Sunday. Let's make sure that we're showing as many options to our neighbors as possible to get involved. And then we just talked about like a flow of our events. How are we going to be pitching this to people, and how are we getting organized? And quickly we realized after our barnstorms that we wanted to pass a resolution in the city of LA. And it was a big question of how to push up. So again, we had this question of how do we reach out to other people to really tackle a much bigger city? And we realized that there was a way that we could talk directly to our neighbors, and we could make the case, and we could build consensus. And that was through our neighborhood councils. There's 99 of them, at least, in the city of LA. So we started making touch with each other and asking each other to really get fluent on our personal stories with Medicare for All. And the first step in doing that was to hold personal meetings in the home to really get grounded in our own stories and on the key points of the bill. And with that, I'll pass it off to Chang Sim to kind of talk about what that personal political education was like, and then of course some of the other building that we did together.
Thanks, Sean. I was put in touch with Sean by the nurses union, and it was basically, between the nurses and Public Citizen and the Bernie, being involved in the Bernie campaign. That was how our group in Los Angeles started. And there were three things we learned from the campaign. In the, a lot of us had been involved in various ways with canvassing and organizing the grassroots, but none of us had actually been involved in the resolutions campaign before. And we took the guide that, Public Citizen had put together on the steps, the organizing steps. But then when we got together, and nobody in the group felt ready to like take the first step in the organizing guide. And we realized, in our discussion, the consensus was we actually had to educate ourselves first about Medicare for All. So, we essentially, the first 3 sessions that we met, over an hour each, 2-hour sessions each time, sometimes more, we decided we had to, we assigned like research and reading, including reading the bill, the financial studies, everything. There was a lot of information that was shared by Public Citizen. So we augmented that reading with our own research. So we essentially conducted 3 self-teachings. And Dr. Bill Honigman was very kind. He drove up from Orange County for each of our sessions to, participate in our teaching. So, in those teachings, we made presentations and asked questions of each other. And it was only after the third such like self-education sessions that we feel like, okay, now we can actually go out and take the first step of talking to the neighborhood councils. And then, so that's the first lesson, was that we actually needed to educate ourselves first before we actually took that first step that was in the organizing kit. And it was foundational because it stood us in good stead, because once we started going out to speak to the neighborhood council members, and we were, asked questions about this or that, we knew what we were doing. We had the information, we felt confident, sharing that information. And at times when we were at, one of the neighborhood councils, one occasion I was peppered with a bunch of questions about how do you finance this, how do you finance that? And I gave them all the information, and it got to the point where I said, do you want any more information? They said, no, we don't need any more. But it made us feel very confident. And that, so foundational, educate yourself, read the bills. Then going to neighborhood councils. You know, I mean, it would seem circuitous, right, to go to neighborhood councils instead of going directly to the city council. But we found that it actually worked because, you know, besides the fact that, you know, we were speaking to our neighbors, like Sheng was saying, well, actually not besides the fact that the point was speaking to our neighbors, we were actually educating our community about Medicare for All. And it was actually bringing in new constituencies, people who didn't really know about Medicare for All, bringing them into the conversation and, you know, turning them into, you know, constituencies in support of Medicare for All and building the base for the cause. So even though we were doing the circuitous route, not going directly, in the end, it turned out to be better because we were building the base of support for Medicare for All. In retrospect, that was what we realized. Then the third point, I think we learned that worked very well, and this is something that Councilmember Mike Bonin said already, we found that our stories, our healthcare stories was always the most persuasive, the most moving, effective way of communicating why you know, we need Medicare for All. You know, we had, you know, sessions when you know, after we shared our healthcare stories, we had these neighborhood council members actually just tell us their own stories about their healthcare nightmare. There was a neighborhood council member who told us her mother worked in the claims department for a health insurance company, but she didn't have health insurance herself. You know, stuff like that. It was incredible. So, you know, so the time that we spend, and that's in the Public Citizen Toolkit, the time that we spent actually practicing our stories. You know, you want to, you know, condense it down, distill it down to 1 or 2 minutes. Because that's about the amount of time that you have, you know, usually to speak, to make your pitch at the neighborhood council, even the city council. So condense it down, and it can be your personal story, it could be your family member or a friend, right? But, you know, tell that story and then usually try to end it with, you know, what the difference would be if you had Medicare for All, how your circumstance would change if you had Medicare for All, CalCare now. So, so those are the lessons we learned. And for the cities that I think don't have neighborhood councils, you could do the equivalent. Go to your churches, the temples, your community organizations, the food banks, you know, your DSA chapters, whatever it is, the community groups, advocacy groups, get them on your side, get them to send letters, you know, to the city council as well, and build that support upwards. And that's how we win. And the last thing I want to say is a pitch to Councilmember Mike Bonin. Thank you so much for championing the Medicare for All resolution in 2019. We want to come back to the city council now, this time to pass a resolution in support of CalCare, you know, state level Medicare for All in California. So will you champion that?
Absolutely.
Yay, thank you.
And you know, one thing I should say on that is another great value to having local councils do this is it's a way to build more people into the organization and into the movement. It gives people an opportunity at the local level to take their voice of advocacy and become more empowered as leaders. And it just gives us more momentum nationally to have the opportunity locally for people to be fighting right in their neighborhood for what they need.
Thank you, Councilmember Bonin. That's awesome to hear and great to have you with us. And thank you to Cheng Sim and Sean. So now I would like to invite Jamie Maravilla to share some tips and lessons learned from her organizing work for successful resolutions in San Luis Obispo and in Santa Barbara.
Thank you. Hi, everyone. I'm Jamie Maravilla. I live in Arroyo Grande, so it's an area of San Luis Obispo County. We're a little different than LA, clearly. We're a very small town, small county. I think our whole county has about 250,000 people total. So we're a very small area, which might be a good tool for other small areas, I think. So I'm part of a kind of a group of people that have worked together to pass the resolutions that Brittany mentioned, as well as trying to work on some of our other smaller towns and areas. I think a lot of them are actually in the attendees right now. So hi, y'all. Great to see everyone. It's a great group of people who are really passionate. And I think that's like an important tip, is to find that great group of people that are really passionate about the subject and that are just connected in that way and have that good rapport. It's really helpful. It's also helpful if they have good connections into the city and into the various cities in your area, which we do. We also have a veteran organizer in our group, Walter Heath, who's on here, and he's amazing and was able to really, really guide us in the right direction and get us all on the same page to make sure that we were going to get this accomplished. So big props to Walter. Thank you so much. So for us, it was really a two-part process, how we kind of looked at this and did this. The first step was that we needed to convince the council to introduce the legislation as a resolution in their agendas. So we found a council member, in our case in SLO, it was a mayor, that, you know, is a strong Medicare for All believer. And she really helped us kind of frame things in a way that might get the other council members to start to support it as well as the city staff, which was also important because they're part of the agenda making process. What we did was we looked at the city goals, or like the legislative agendas. Each city kind of has their different thing, and connected our talking points to those goals or agendas. So for us, we really focused on healthcare equity, the high cost of healthcare in the area, which I think could be on everyone's agenda as well. And then just the fact that our cities spend so much freaking money on health insurance for their staff members. It's really a budget issue, and how much money that they can save if we went to a Medicare for All or CalCare kind of situation. In order to not burden the staff, we also presented them with the written resolution and the background information already. So that way they weren't like going to come back to us and be like, well, that's going to take a lot of work for our staff or something. So having that ready, and I believe we got that off of in the resources that are provided, was really, really helpful, because that way it's just there and it's ready to go. So that's also something I would highly recommend. While we were doing all this kind of organization with the city, we were also organizing with other Medicare for All activists and asking them to call, send notes to the city and email and call and, just kind of ask for the resolution to be put on the agenda. We provided sample emails, we provided a list of the city council members, and it was a very successful campaign, and we got it on the agendas. And then the second part of the process began then, which was trying to get public support and getting people to call into city council meetings, and provide public comment on the resolution, which again, we had a sample script, we had sample emails, we distributed it to our list, and we got them passed. We got, I think it was 3-1 in SLO and 7-0 in Santa Barbara, which was absolutely amazing. So, just overall tips are really knowing your audience and who you can work with. In those smaller towns, you probably know the people that are on your council, who you need to work with, and talk to them and get to know how them and their opinion on how they could see this going through their particular city. And then make it easy for the city to pass it. Supply those resolutions, supply the background information, supply all the tools that they need to know that this is a good idea. And then, just use the tools that are available and get in contact with people. You don't have to reinvent the wheel on anything, which is fantastic. It's great to have all those things. Yeah, so hopefully we're going to get the ball rolling at some more smaller cities in our area, and I wish the best of luck to all of you doing the same.
Thanks, Jamie. So great to have you here and to see you finally. So finally, I would like to invite Jason Breedenbach to give an update on some of the ongoing organizing efforts in San Diego.
Hi all, my name is Jason. I'm down here in San Diego. We created an organization down here to pass a resolution called the San Diego Single Payer Initiative. And it's kind of an umbrella group. It's comprised of many organizations down here, including the San Diego Progressive Democrats, the DSA, National Nurses United, and a lot of independent people that are just interested in getting Medicare for All passed. So we have not passed the resolution yet, but I definitely want to give a shout out to Los Angeles, Sheng and Sheng because we've learned so much from them. They gave us a great webinar. They shared their time with us and told us all about the valuable lessons in contacting our town councils and establishing relationships. So I definitely want to put an emphasis on, we're a big family here. So sharing information, sharing tips, this is essential to getting these resolutions passed in our respective towns and cities. So also another shout out to the Medicare for All resolution website, because that was essential in helping us carve out exactly what we wanted to do here in San Diego in terms of honing our language. So a couple things that we've learned right now, I'll tell you where we are. We have just completed our language, our verbiage for the resolution itself. And we're looking now to approach those town councils. So our next strategy is to find an ally in the city council that we can bring with us as a powerful person to establish that communication with the town councils. I'm hoping to get a council member called Monica Montgomery on our side in District 4 of the San Diego City Council, so she can come with us to the town councils and get this ball rolling here. A couple tips that I would give that we've learned as we've done this over the past couple months is take the language from the Medicare for All resolution website and make it your own. Focus in on statistics that are specific to your locale. For instance, in San Diego, a lot of the Latinx communities have been the hardest hit by the inadequacies of our healthcare system. So we really focused on that. Minorities, people that have been hit the hardest, economically disenfranchised. Focus on COVID-specific data, because COVID has really changed the landscape and really made it even harder for people to access healthcare because of job loss. Myself being a person who lost his job, and I'm still unemployed and uninsured. So it's affected me in many ways as well, and really given me a passion to go through and get these resolutions passed. Keep the resolutions short and powerful. We came up with, I think, a 7 or 8 page document, kind of hone in on the language that you need, that's the most impactful, that will create the most resonance in the people that you're trying to reach. You can always attach a supplemental document that has more statistics, and that's what we're doing right now. We're taking a lot of that data that we also collected and creating a supplemental document to the resolution, but we're keeping the resolution down to about 1 or 2 pages. And I want to also emphasize what Councilmember Mike Bonin said and Sheng is, we're going to focus on personal stories. We're trying to outreach to a lot of members of our community that have personal stories to share, stories about being uninsured, stories about how being uninsured or being lack of or underinsured has created a situation where we couldn't get the care that we needed to those people. So that's what we're trying to do is find those people and those powerful stories that we can use to translate how essential Medicare for All is and why we need these resolutions passed. So that's what I would say. Those are the tips that I would give. And again, thank you so much for everybody sharing with us what you've done in your communities, especially LA.
Thanks so much, Jason. And to all of the amazing local activists who have shared your experiences. I think what's very clear is that there's a wealth of organizing experience and creativity, not just those who spoke, but all these great tips and suggestions and ideas that we've been seeing in the chat, which is great that we can draw on. And I think that's a key point, is that we can share with each other and learn from one another and help each other go. So I'm really excited. I think as we launch this special push for municipal resolutions in support of CalCare and Medicare for All in cities and towns across the state. I think we had a lot of questions in the chat. I think we've been trying to keep up with them as we go. I mean, one of the questions that came up a couple of times was whether these resolutions should support CalCare or Medicare for All. And the sample template that we have points to both, because for the municipality, you know, Medicare for All is what we want eventually for the whole country, and CalCare would provide for that for all of California now. And so we want to, to the extent that we can get support for both of those, that will be helpful in our advocacy, both with the state assembly members and then also with the federal districts and members of Congress as well. That would be terrific. I think we have, Phil, I don't know, were there any other questions that you felt like we should answer?
Well, there's a lot of questions. First, I'll just say, if you want to ask us for CNA, we're happy to answer any questions. We check this account on a regular basis. It's info@medicare4all.org. So feel free to reach out. And then I believe Public Citizen has your contact information on all your documents. So definitely, if we don't get to your question, send us an email and we'll get back to you for sure.
Great. So we've covered a lot of ground today in this training. There was a lot of links put out in the chat. And as we said, we will definitely be following up over email. We will, and feel free to reach out to us if you haven't heard from us and you're eager to get going. And I want to really give special thanks to all of our speakers, especially Mayor Garcia and Council members Bonin and Thao, who took time out of their very busy schedules to share their commitment and insights with all of us. We're extremely grateful. The main thing we hope you take away from this training is that together we are going to continue to build a powerful grassroots movement in each of our communities that will be the groundswell of energy that we need to finally move to guaranteed healthcare for all Californians over the finish line. California really has the opportunity to be a leader for our country. And so we're thrilled to be working with all of you, town by town, county by county, to make that a reality. So please sign up on the map. If you haven't already, let us know if you need anything along the way. We also, the Medicare for All Resolutions campaign hosts monthly national webinars. So keep an eye out for those upcoming opportunities to stay connected with people all over the country who are doing this work as well. So Phil, do you want to share any closing remarks from CNA before we wind up?
Yeah, thanks again, Melinda. Thanks to all of our speakers. Thanks to all of you on the call and all of you so active in all your communities. I'm going to end with just one new update, one announcement about the CalCare campaign. So I'm excited to announce that we are organizing another big day of action on Saturday, April 17th. We're asking folks to host what we are calling CalCare Speakouts in cities all across the state. And these COVID-safe actions will involve people gathering and staying in their cars and using a conference line to focus on sharing personal stories about our broken healthcare system. We heard all tonight about how impactful personal stories are to make our case. And CNA will be hosting about 4 or 5 of these events, and we'll need your help to host events in other cities all across the state. We need to demonstrate widespread support throughout the state. Again, that's Saturday, April 17th, and this date is significant. Here's a little bit of news for some of you, because the Assembly Health Committee has requested an analysis of AB 1400 by an entity called the California Health Benefits Review Program, or CHBRP as they call it. And tentatively, that is scheduled to be delivered to the legislature on April 21st. There is a possibility that this analysis will be used to bemoan the cost of the CalCare program and use it as an excuse to stop the bill. And in reality, we know that numerous studies have consistently shown that single-payer healthcare systems are cheaper and far more efficient than our current profit-driven, inefficient patchwork. And we also know that too many people are suffering and going bankrupt from our current system. And in fact, a majority of Californians say that they or a family member have skipped healthcare in the past year due to cost. So the purpose of the CalCare Speakouts on April 17th is to highlight patient stories and the brokenness and expensiveness of our healthcare system at this critical moment in the legislative process. So we'll have more information coming out very shortly about the CalCare Speakouts. So stay tuned to your emails. It's April 17th. We'll need your help to host these events all across the state. But again, thank you all on behalf of the 100,000 members of the California Nurses Association. We appreciate all your work, and we're looking forward to winning healthcare justice with all of you. Have a great night, everybody.
Thank you.